Welcome back to WCBI Sunrise on FOX4. Now, this may be the season for colds and sore throats, but you may want to look for a primary care clinic before you get sick. Amanda Fondren is a nurse practitioner here with us today from Omnis Health Clinic. Thank you so much for joining us.
Thanks for having me.
So I'm going to tell you all a fun fact. HIPAA, not really, but Miss Amanda has treated me before, so I know she's great. And I didn't realize that until I saw you. I was like, oh, yeah. So that made it better. So Miss Amanda, my first question is, why does someone need a regular physician or nurse practitioner?
I think it's good to have an established relationship with a primary care provider, somebody that gets to know you and knows history, knows kind of some of the things that you deal with or that you're very healthy. And it can help them in your care as the future comes forward, and if something comes up that you've not experienced before, you can work with them to help solve problems in your health.
Now, I know that some people are very nervous to go to any doctor. How would you say if they picked a primary care provider that it would maybe help them be more comfortable visiting the doctor when they need to?
So I would say that finding somebody whose personality you're comfortable with, working with your personality, just like in any other business, everybody you see may not be your cup of tea.
Okay.
But to find somebody that is that works well with you and you can communicate to and listens to you is part of a good relationship between a provider and a patient. And
so talk to me about how primary care providers can care for the whole families. You said that you have several, correct?
I have many families,
really?
Like extended families. Some primary care providers don't prefer to do that, but some do. I like taking care of whole families because it just helps you develop the connections and the relationships to your patients and helps you provide better care, in my opinion.
I feel like also it'd be kind of like a one-stop shop in a sense. We're not having to go everywhere. We get to just come to you and you can take care of us when we're feeling sick. But you don't always have to just come to you when you're feeling sick, correct?
That's right.
So talk to me about what's some other things, even if I'm not feeling sick, that you could do for me and my family.
Wellness is an important thing to do for really healthy people that don't have any medical problems. Every 1 to 2 years, just get a good basic blood panel and a good checkup just to make sure you don't have problems you're not aware of. A lot of medical problems can sneak up on us and we don't know that we have a problem until somebody picks up on it. So, so wellness, a lot of people optimize their wellness with options that are not necessarily treating sick or even reviewing just basic lab. So,
and then talk to me about how if I don't come to the doctor, then you're never going to know if something's wrong, if there is a medical issue.
We can't do something about something we don't know about.
Yeah.
So, yeah.
And so talk to me just about if someone is wanting to find a physician, how would you recommend them to go about it?
I would recommend talking to friends and family, seeing who they like, who takes good care of them. You can, a lot of Facebook clinics have options, and you know, just mainly friends and family is a good way to find out good people.
Perfect. We could talk your heads off all day, but we will be right back after the break. If you have any more information on Miss Amanda's team, or if you want to make an appointment, check out the number on your screen.